This conference will now be recorded.
So hello, everyone. Thank you so much for being here today for our presentation on pelvic health after breast cancer. You know, sadly, women's health issues often get overlooked. So I'm so happy to see all of you here today taking the time to educate yourself, as it's such an important topic. My name is Jennifer Wang. I'm the president of Paradigm Medical, a national medical products distributor. We specialize in post-mastectomy and breast care, lymphedema, and orthopedic footwear and foot care products. It is our mission to provide great medical products to underserviced markets in Canada. We believe that all people should have access to great medical products. Most notably, you'll know us as the exclusive Canadian distributor of American Breast Care, a line of post-mastectomy products for women who've undergone breast surgery, and biocompression systems, a line of pneumatic compression devices for individuals who need treatment of lymphedema and venous disease. We are a Canadian business who's been servicing all of Canada for well over 25 years and are headquartered in Toronto. I'm very honored to be introducing Nicola Robertson, our speaker today. She is joining us from Belleville, Ontario. Nicola is a founder, a registered physiotherapist, and pelvic health and chronic pain specialist. Through her own personal journey, Nicola developed a special interest in pain science and the management of chronic pain, which has led her to become an advocate and educator of women and their pelvic health. Nicola is on a mission to help women have pain-free and active lives by developing awareness of their bodies. She's a member of the International Pelvic Pain Society and International Continence Society, the Canadian Physiotherapy Association, Orthopedics Private Practice and Women's Health Division. She has been a tireless teacher, respected researcher, and a great clinician. We are so grateful to have her speak with us here today. So Nicola, with that, I will pass it over to you.
Hi, everybody. As Jennifer said, my name's Nicola, and I'm a pelvic health physio. I just want to thank you all before we get started for taking time out of your day, and thank Jennifer for inviting me along to talk. This is something that's very important to me, and I just feel it's something that is so ignored in the healthcare system. Because when we're looking after people with breast cancer, the focus is, of course, on the treatment, the recovery, and survivorship, but we kind of get lost in all the other things that happen along the way. So breast cancer treatment sufferers go through treatments that can lead to lower levels of estrogen. And basically, this induces symptoms similar to that of menopause. So estrogen, as many of you know, is really important for vaginal health. And it keeps the tissues healthy, it keeps them lubricated. And when we see lower levels of estrogen, which can be induced through chemotherapy and ovarian removal, which a lot of breast cancer sufferers opt for because of the added risk, we can see changes. So some of the changes we see, so vaginal changes include dryness, atrophy, itching, burning. It can increase the occurrence of urinary tract infections. It leads to weakness in the muscles. So when muscles become weak, we can see incontinence. One thing that's not on the slide is prolapse as well. We also see painful sex. We see urgency and lots of pain associated with that. The other changes we can see as well with the loss of estrogen levels, hot flashes, night sweats, mood swings, and joint pains. Now, we're not quite sure why we see joint pains yet. We're still working on the research of it, but the other things are all fairly typical when we enter a menopausal state. And, you know, it's unfortunate because the research actually says around 50 to 75% of survivors will experience this. but the numbers are ridiculously low on how many people will actually talk to someone about it. So you're probably looking at 20% of people will actually mention these problems. They just accept it as part of their lot in life and don't think much more can be done for them. So I have a passion for the pelvic floor and the pelvis, so I'm going to give you a little anatomy lesson. Don't worry, there's no tests at the end. Although if you want one, I can make one up, no problem. So you can, if you look at the bony structure, you can see it's a fairly strong bone. In fact, those hip bones at the top, those curved bones called the ilium, are actually the second strongest bone in the human body after the skull. And it kind of creates this nice kind of round supported structure. It connects onto the spine, and it also creates the hip socket. So you can just see where the hip is. So that when we're talking about pelvises, we're talking about hips, we're talking about backs. Then when you go over to the other side and you can see this group of muscles, that's the pelvic floor. So the pelvic floor isn't just one muscle, it's a group of muscles. And there's actually 3 layers to it. It's an incredibly versatile group of muscles, but what I find really fascinating about it, we only started talking about it in 1948, and you may recognize the person who mentioned it first. His name was Arnold Kegel, Dr. Arnold Kegel. And when he talked about the pelvic floor, he talked about the fact it's the only muscle group that sits perpendicular to the floor when we're standing and holds a significant amount of weight. So basically all your intestines, your stomach, your bowel, your uterus, your bladder, they're all held in place by your pelvic floor. So it's got an incredibly important job to do. So what does it do? Okay, so continence, okay? As a pelvic floor physiotherapist, and I mentioned in the first slide, continence is something we see a problem with. So continence is the ability to have urinary movements and bowel movements under your control. Anything that's not with your control is actually termed incontinence. The second function, if you see the picture on the top right, and it shows sorry, I'm just going to move it shows the pubic bone to the coccyx, and you'll see there's a sling of muscles through there. And we have the bladder, the uterus, and the bowel. Obviously, men don't have a uterus, but they do have a pelvic floor and a bladder and a bowel. And what can happen is if these muscles, this pelvic floor band becomes weak, it can cause the vaginal walls to become weak, and the bladder or the bowel can actually push the walls of the vagina down, and this creates what's called a prolapse. Also, we can see the uterus coming down, which can also create another type of prolapse. I know, again, I mentioned people have hysterectomies and oophorectomies after they've had breast cancer as a preventative measure, and they can create what's called a vaginal vault. So they remove the cervix, the uterus, and the ovaries typically, and that also can prolapse. So I've seen all of those things. The next function that's important that we talk about is blood flow. So you can see the red arteries and the blue veins, and the pelvic floor is right in the middle of that. So what would indicate poor blood flow? So varicose veins, restless leg syndrome, poor circulation to the feet and legs. Now those can be caused by other things, but pelvic congestion can be a contributing factor. Another function is sexual function. So nobody likes to talk about sex, but it is a human function. It's something we should be able to do if we choose to do it, and we should be able to do it without pain or discomfort. Also, ladies, we should be able to orgasm. So next slide. So the other thing, which is, these are kind of this is my favorite piece of information, is your pelvic floor is actually part of your core muscles. So there's a myth going around that your core muscles are simply your abdominal muscles. That's nonsense, and most of us have a much stronger core than we give it credit for. So our core is actually made up of 4 muscles. We have our diaphragm, So that is up underneath our lung tissue, and it comes down and up to allow air to come in and out. We then have the pelvic floor muscles down at the bottom, creating the top and bottom of this wonderful canister. Then we have this deep abdominal muscle, and it's deep. It's nothing to do with your six-pack. And it's called your transverse abdominal muscles. It kind of acts like a corset. And then on the spine, we have this small muscle called multifidus, and it's actually involved in extending your spine. So when we're thinking about the pelvic floor, we're also thinking about core muscles, okay? The other thing is the emotional response of the pelvic floor, which I find when I start talking about this, people think, oh, she thinks she's a psychologist. I absolutely don't. I know my role very well. But we also have to acknowledge that any pain, discomfort, or distress we feel isn't just emotional, it's physical. You stub your toe, you don't go, oh, dash, that hurt. You normally have a fairly emotional response to it. If you get your heart broken, which I'm sure many people have experienced, you can feel ill and tired, and not just an emotional response, you have a physical response to it. So we know that all mammals have a pelvic floor, and dogs have a pelvic floor. And when dogs are happy, their tails wag. When we are happy, we walk with a little spring in our step. When we are sad, some dogs do exactly the same thing. They tuck their tails between their legs and they kind of hide away. We do exactly the same. So we know that the emotional stress that people go under during breast cancer treatment, from the moment they discover the lump right the way through, can have a negative effect on the musculature of the pelvic floor. And it has to be addressed, and it has to be talked about. People do not give credit to the human body and its emotional response enough. So what happens? So we've talked about all the things it does. So what happens when it goes wrong? So there's lots and lots of different things that can go wrong. And the most common one that I see people for is some form of incontinence. So urinary or fecal incontinence. So there's different types of incontinence, and it affects both the bowel and the bladder. So we have passive incontinence. Passive incontinence is basically where we have urinary loss with no apparent reason. So it's kind of passive. We see it a lot post-surgical. So someone who's had a hysterectomy, a prostatectomy, or someone who's had a prolonged period of a catheter in place, which can happen after surgery. And basically, the assumption is the nerves between the bladder and the brain have been damaged somehow, but it can be dealt with. We see urge incontinence. So urge incontinence is when you're just going around your day doing nothing exciting, and all of a sudden you have to go to the toilet. You have to go that exact moment. You have no time. Now, some people will in fact make it to the bathroom and not have any loss of urine or fecal matter, but some people really have a lot of loss, but both are types of incontinence. People with urge incontinence as well can also develop a habit of going to the toilet on a regular basis, and we call that frequency. I have clients, and I have seen clients, who are going to the bathroom every 10 to 15 minutes throughout the day, which, as you can imagine, has a huge impact on their quality of life. The most common one that people think of is stress urinary incontinence, and this is when we place a stress on our pelvic floor. So the picture down on the bottom right is someone doing a fairly heavy front squat maneuver, and that will definitely cause pressure on the pelvic floor, but as a general rule shouldn't result in leakage. Neither should coughing, neither should sneezing, neither should jumping on a trampoline. And lots of people will tell me, oh, well, I've had a baby. Well, it doesn't really explain to me why we see people who've never had children having incontinence. The youngest client I've ever treated was 16, and she had stress urinary incontinence. So we see it in athletes, we see it in older women, we see it in men, we see it postmenopausal. So again, thinking back to the effects of the breast cancer treatments, we put people into menopause and we are more likely to see incontinence. The next thing is obviously sexual dysfunction. So again, when we're thinking of breast cancer survivors, there are lots of reasons why they do not want to have sex. And some of them are related to the way they feel physically, but also some people simply can't because it is painful. The atrophy and weakness in the muscles results in extreme pain when they're trying to have sex. And this can put a lot of pressure on what is potentially an already strained relationship. Again, we like to talk about sex, but only in a humorous way, whereas I like to tell people it's sex is normal, and if that's what you want to do, we need to find a way for that to be comfortable and fun. Pelvic pain and low back pain are two things I see lots of, and around 75 to 90% of people with low back pain will actually have pelvic floor dysfunction. Pelvic pain is harder to define, but it really is any pain from the waist down, so it encompasses that low back pain, just above the knees. The biggest thing we find is lots of people, again, put in these menopausal states, they develop joint pain, and then they really are kind of lost in what to do, and pelvic health is one of the things that has to be addressed along the way. If you think back to the slide where we talked about the core, the influence the core has on the pelvic floor, it's part of the pelvic girdle, that we really have to address the whole system. And I think lots of people go off and they do core strengthening, and they really aren't thinking about what's going on with their pelvic floor or addressing any dysfunction they have. So what can we do, and what recommendations can you give to people who are expressing these concerns to you, or even just giving generalized advice? So first and foremost, vaginal moisturizers. It really can improve the tissue health. It can reduce the burning and pain, reduce the occurrence of UTIs. It basically helps by increasing the water content of the cells, and it lowers the pH in the vagina. They can be applied regularly, up to 3 times a week or more. And there are some that are for specific use internally. So Repagin is actually a suppository type, and then there are some that are just appropriate for the external vulva. So I have a couple that I recommend, and if anyone wants a list, you can talk to Jennifer and I can compile that list for you. Davina by May, May by Davina. Any client I've ever had who's used this has been really positive about it and found it really helpful. I did see it in Shoppers Drug Mart recently, but it's also available online. I also find Repagin's helpful, and Replens, which here I've shown a lubrication, but they also have an external moisturizer as well. You can also use vitamin E cream, olive oil, coconut oil, but I wouldn't recommend using any of those things internally, simply because the pH isn't great. Vaseline, body lotions and massage oils are an absolute no-no. They simply are not appropriate for the delicate tissues of the vulva. They can cause yeast infections, and if people are using birth control, birth control such as condoms, they will disintegrate. So not a healthy option. Lubrication. I love talking about lubrication, which makes me sound a little bit odd, but it's completely underrated. People think it's embarrassing to have to use lubrication to improve their sex life. However, it's extremely, extremely helpful. So it provides a barrier to protect against friction. It helps create lubrication where there may be none. And really, I find lots of women are super excited when they discover the lubrication for them. So my personal favorite is Slippery Stuff, which I believe can only be purchased online. I know some pelvic health physios stock that as well. Sliquid And there's also one I've seen in Shoppers Drug Mart called Good Clean Love, or Good Clean Loving. But lots of people will go to Shoppers Drug Mart and they'll buy, you know, the Durex brand, the Trojan brand, and unfortunately they contain glycerin, parabens, and alcohol. So that's not very helpful for the fragile tissues. So you're actually just going to create a bigger problem. So I always tell people, have a little look on the side of the packaging. The less ingredients, the better. There's a few different types. There's silicone-based, water-based, and oil-based, which would be like an olive oil that you can use yourself. They all have pros and cons. The water-based ones, which is what slippery stuff is, I find doesn't last as long. And so I would recommend a silicone-based one, but the silicone-based one will stain bed sheets. Olive oil, well, like I said, not so awesome for internal use, but in a pinch, you can use it. Absolutely no coconut oil internally, though. The other thing is skincare. So we live in a society where women aren't supposed to smell like women. You can always jump into Shoppers next time you're in, go down the feminine hygiene aisle. There's no male hygiene aisle, just for your reference. And there are scented products for your vagina. So there are coconut and lime, vanilla. Your vagina is meant to smell like a vagina. So I suggest warm water over the vulva. You can certainly use soap in your groin, use it over your backside, absolutely no problem, but we should not be using soaps, and definitely not internally. And I know there was a phase, thanks to a Hollywood celebrity, of douching. We don't douche, never douche. So cotton underwear. Sounds silly, but wearing cotton underwear, you know, your big granny pants, the ones we all actually like, but we feel we shouldn't wear them, they are the ones we should be wearing. Give your skin some air. There's nothing wrong with wearing the nicer underwear, but maybe pick and choose when that is. So, general health, you know, this is as a physiotherapist, people kind of wonder why I'm talking about general health, but it's actually part of our mandate to talk about general health. And if we think about the influence the pelvic floor has in conjunction with the core, the lower back, and the hips, we need to get moving. So the World Health Organization's recommendations are 150 minutes a week, which works out to be 30 minutes, 5 days a week. And I always suggest 2 sessions of resistance training. So the reason we need to do some resistance training is to improve our muscle mass. Okay, this can help with the joint pains that we mentioned, and also it can help with heart health. I don't know how many of you are aware, but there are more women over the age of 65 dying from heart conditions than from breast cancer. Unfortunately, having been through breast cancer treatment, chemotherapy, radiotherapy, and surgery, women are then even at higher risk of heart-related health conditions. So making sure people are actually getting back to exercise or starting exercise as soon as they're able. We also know it has great effects for lymphedema as well. Reducing your body weight 5 to 10% has been shown to reduce incontinence by up to 50%. So, you know, a small change can make a big improvement. And also diet. So I don't like giving people too much, have a hard time about their diet, but reducing things that irritate the bladder, alcohol, caffeine, sodas, spicy foods, citrus fruits, can all be beneficial. I think the hardest thing for people is knowing which thing is irritating their bladder. So I suggest cutting it out for 2 or 3 weeks and then reintroducing it for a day and watching your symptoms for 48 hours. The other thing that's important is actually drinking more water, which almost seems counterintuitive, especially to the women who are incontinent. But urine itself is very concentrated and can actually irritate the bladder. So by ensuring you are hydrated well, and the easiest way to check is monitor the color of your urine. It should be a pale yellow. Think of straw in the fields in the summer. Anything darker is an indication you need to take on some more fluid. Anything that's clear is actually an indication you are flushing too much through the system, because it's coming out exactly the same way it came in. And I find that's a kind of common problem with a lot of today's diet recommendations. We're drinking half our body weight, and depending on your body weight, that's a lot. So another slide about general health.
Rule like of how much, is there a rule of how much water we should be consuming in a day? Is there kind of like,
you know, it's a big, it's a big argument. So, you know, there's everything from 8 glasses to half your body weight, depending on who you talk to. I advise people, the best information we've ever got, and this is coming from urologists that I've spoken to, is simply monitoring your urine color. And then finding your kind of happy place. And I always, the other thing to remember, if you're a coffee drinker, and I'm a coffee drinker, to outweigh your coffee, you need to drink a glass of water. So if you're drinking 4 coffees a day, you have to drink 4 glasses of water before you're at 0 again. So people, there's no, I'm sorry, I can't give you a better answer than, you know, X amount, but we're all different, right? So it's finding.
Yeah, no, that's good. So just monitoring the urine.
Yeah, and that's
so it's got to be pale yellow, and if you've overdone it, you'll know if it's clear, like completely clear.
Yep. So bowel movements, I also like talking about poop, sorry everybody. But again, we see problems with bowel function after cancer. We see it with anyone with pelvic floor dysfunction. Your fecal matter passes through the rectum, so we have to make sure we have healthy bowel movements. Does anybody know, and people can unmute themselves, how many bowel movements you need to have a day? Has anyone got any clues? Blank, silence. No.
Once a day, twice a day?
So anything from 1 to 3 is ideal, okay? 3 is perfect, to be completely honest, because we should eat, poop, eat, poop, eat, poop. But
so
I think
1 per meal?
Yeah, pretty much. Yeah. However, we always, as a pelvic health physio, I always aim for once a day. I mean, I can see people who are having 1 a week. So if we get to once a day, we're doing pretty well. And a lot of times it's lack of fiber and lack of fluid is the common problems. And again, people who have been unwell for a period of time, their diets changed, their digestive systems changed. So everything that worked for them before doesn't work anymore. So if they're struggling, you know, recommend a nutritionist, or they can go online and look up fiber. You know, we should be having between about 27 grams of fluid, of fiber a day. Some people do okay with 18. Some people need to go as high as 30. And again, it's trying to find the one that works for you, the amount. The other thing I recommend, and it's pictured here, is a squatty potty. Now, squatty potties have become a bit of a gadget gimmick. There's a really good video on YouTube. You just type in squatty potty and there's a commercial, and it's fabulous and explains it way better than me. But basically there is a muscle in the pelvic floor that wraps around the rectum and keeps it kinked. So when we are walking around, we don't have poop coming out of us. And when we sit down, unless we have our knees slightly above our hips, that will remain kinked, which, as you can imagine, makes it a little bit harder for things to get out. So I suggest buying a squatty potty, buying a stool, using your garbage can. You know, your knees do not have to be up at your chin. If you see from the picture, her knees are just slightly above her hips. So we have created in the Western world wonderfully high toilets because, you know, we're so civilized, we don't want to squat on the floor. Eastern cultures generally squat, and they have healthier bowels than we do. So to counteract that, pop something underneath your feet. Okay. Stop smoking. Just, I'm not going to say anymore. I just always put that on my general health slides. Stop smoking, plain and simple. And address other health issues. So if people are diabetic, have high blood pressure, those things need to be addressed. The anxiety, depression, stress, anything emotional that's going on in their life has to be addressed and managed. It doesn't mean taking it away, it means managed. All of these things can reduce pressure on the pelvic floor. And small changes can make a huge difference. I think the biggest problem is we're all looking for the big change rather than acknowledging the small changes we can make. So everyone wants to know about pelvic floor exercises and how to do them and what's the best way to do them. It's hard to give a generic answer to that. However, there are some exercises out there that basically work for everybody. And in a second, I'm going to put my video on just so I can demonstrate some of those exercises for you. So if you think back to the slide, and I can always flash it back up if you want, where you saw the diaphragm at the top and the pelvic floor at the bottom of the core muscles. When we breathe in, okay, so if you all just take a breath in and think where your diaphragm goes. Does it go up or down? And I'm going to help you here. It goes down, okay? That means your pelvic floor goes down as well, okay? So lots of people, when they really need the bathroom, they hold their breath. Cross their legs and hold their breath. I'm telling you now, you're not going to make it. The best thing you can do is actually breathe, because when we breathe out, our diaphragm moves up and our pelvic floor follows it. So learning to breathe can actually be a really, really empowering experience for people, and learning how that affects their pelvic floor. So I know I can't see any of you, but I'm assuming most of you are sitting. So sit in a fairly good posture, whatever that feels like for you. Make sure you can feel those bony parts in your bum. And I want you all to take a breath in through your nose and then a slow sigh out. Okay, so we're going to do that. So I breathe in through the nose and then a sigh out. Okay, this time I want you to do it again, and I actually want you to acknowledge what's happening at your pelvic floor. So for most of us, that I would think about your perineum, so the space between your vagina and your anus. Okay, so a breath in and out. Now, some of you will feel that change and some of you won't, okay? But by practicing breathing on a regular basis, you can actually connect better with your pelvic floor. You can understand how the mechanics of it work. You not only are learning how to lift it, you're also learning how to relax the pelvic floor. Okay, the pain relief exercise I'll actually demonstrate for you in a moment or two. And then there are genetic stretches that I think anybody, whether they have pelvic floor dysfunction or not, can benefit from. So the first one is child's pose, and then we have a cat-cow exercise. So I'm just going to pop my video on. Just bear with me a second. Okay. And I'm gonna hide my screen for a second. Just bear with me, and hopefully you can all see me. So when we're thinking about positions for pain relief, so let's turn my back. So lots of people will come to me, they have pelvic pain, they don't really know what to do about it. And I tell them the first thing you need to do is find somewhere that feels comfortable. So I always suggest lying down on the floor or somewhere where you can prop your legs up. Pop your legs up here, and you're actually making sure your calves are fully supported. And then,
sorry, Nicola, are you were you supposed to have your camera on?
Yeah, is it not working?
No, I think if you there's a little camera button on the bottom.
We can see it.
Oh, you can see it? Okay. Maybe it's just me. Okay, there we go. Sorry about that. So what you need to do is go to view. You probably did what I did. If you just go to view who's talking, in the
Yep.
middle of your screen on the top.
Yep.
You should be able to get her camera.
Thank you.
There we go. Can people see me now?
Yep, I think that's
Yes.
good.
Perfect. So you're going to suggest to people. Perfect. So they're going to be lying on their back with their legs up on something supportive. So that can be a chair, a sofa. And this is a pain relieving position. Okay, it's that simple. They can tuck a pillow underneath their back if need be, and practice that breathing technique while they're there. So hand on chest, hand on belly, breathe in, sigh out. Nice and simple. Okay. The child's pose. So I have a little joke. I tell people if they're not doing child's pose, they're not living. And also, if they're not doing child's pose, they've never seen me before. It's one of my favorite exercises, and I don't really know anyone in the world who won't benefit from it. But when we're doing it for pelvic floor, I suggest wide knees. I'm just going to tip my camera down a touch. So wide knees. You can use a bolster or a pillow between here, and then you're coming down into this position. Okay, it's pretty basic, and I recommend people hang out there 30, 60 seconds, and again, doing some deep breathing. The last one stretch that I like is for the muscles that run from front to back. So child's pose works this way, and cat-cow works front to back. So again, people are getting into all fours, and rather than thinking about moving your back, I want people to think about the pelvis. So tucking your pelvis in, and then tucking your tail up. So when we think about the pelvic floor, we're trying to move it back and forth. So we're lengthening and shortening. So I'm just going to share my screen again. And take my video off. So hopefully everybody can see that. And so I'm going to talk about Kegels. Everyone always wants me to talk about Kegels. So Kegels are great. There's nothing wrong with Kegels. They are very helpful, and they can be used whenever, if they're used properly. So a Kegel is the action of lifting and squeezing the pelvic floor. Okay, so this is what a lot of people miss. Sorry, I keep hitting the wrong button. So a lot of people miss the fact that you have to lift and squeeze. They either squeeze or lift. They don't do both. So again, where you're sitting right now, just think about where your pelvic floor is. And what I want you to imagine is squeezing the pubic bone and the tailbone together, and then lifting the perineum up. Now, if you find this easy, you either have great pelvic floor strength or you're an expert in Kegels, and that's great. Okay? But this is really simple. There's lots and lots of information. People just need to head over to YouTube and you will find 50 different ways to do a Kegel. Lots of people teaching it. I can recommend online programs for people who cannot access the information themselves. But that's essentially what a Kegel is. The other problem I have with Kegels is people overdo them. So I'm seeing people doing 200-300 Kegels a day. Okay, now, yeah, it's not hard to work. It's not hard work. You should be able to do it without too much discomfort. But doing them to excess is not going to rectify the issue. In fact, if anything, it's going to make the muscle tight, sore, and tired. Okay, so my recommendation is no more than 20 Kegels a day. And you want them to be good Kegels. So if you're not good at Kegels, start with 5. Start with 2. Get good at what you're doing and then build it up over time. If I asked you to go and run a marathon and you've never ran before, you are not going to leave your house and go for a run. You're going to start by walking for a minute, maybe jogging, half walking for a minute, and you're going to build that up. And it might take you a year, it might take you 2 years, it might even take you 5 years before you run that marathon. And that's the biggest thing. We all want that quick payout. We think if we do more, if we buy the gadget, if we get the Kegel balls, if we get that thing that's advertised on YouTube, that our pelvic floor will just be perfect in a minute. And that's not how it works. If it did, we would all be doing it. Core strength is also important, but there's a myth around core strength. People think they have to do sit-ups. Squats are core strength, walking is core strength, running is core strength, lunges are core strength. Anything that involves you moving your body, you're using your core. Now you can get into more specific things. I have a picture here of a lady doing a bridge, and that's a personal favorite of mine, but you can also do your Kegel while you're doing your bridge. So again, there are lots and lots of free resources out there for people to access. Okay, final thing.
Hi, Nicola. Are you, sorry, we just had a question.
Yep.
Are you on the slides right now, or are you on the video?
I'm on the slides. Can you see the slides? No.
I think some people are having challenges seeing the slides again. If you just share the screen. Oh, there we go.
There you go.
Can
Sorry
everyone
about that.
see it?
It's just the same. Sorry about that. So yeah, there wasn't anything exciting. Just an image of someone doing a bridge. So I promise you didn't miss anything, ladies. So the last thing that I always tell people, sex. When it comes to sex, don't be scared. People empower people to, try new things, access support, and talk openly about these things. You're all seeing people in these situations and they're fearful and they're scared and they don't know how to talk to people about what's been going on in their life. So just be a sounding board. Obviously, you probably all have way better resources than me, but from a pelvic health perspective, we talk about people seeing sex therapists. There is a severe lack in Canada of good sex therapists, but they are accessible online, so people can find them anywhere. Primary health care providers, especially if we're seeing people who have tried the lubrication, they've tried the moisturizers, and they're just not getting any better. They may need what's called an estrogen cream to help. There is reluctance around giving that to people with breast cancer or who have had breast cancer, but it's people's choices. Emotional support, so support groups, counselors, social workers, those kind of people. Pelvic health physiotherapy, obviously I'm going to put that in there. I probably about 5-6% of my caseload are post-cancer patients. And then the North American Menopause Society has great information on it for anything to do with the menopausal changes that can occur. And that's really what we're dealing with when we're dealing with post-breast cancer problems, is menopause. So that's everything for me. It was fairly quick, fairly short, but I thought keep it short and simple so it's good information you can pass on to people you're meeting. Feel free to contact me through Jennifer if you have any more specific questions, but thank you very much for having me.
Well, thank you, Nicola. That was really, really great and informative. I liked your sort of one-on-one tutorials about the exercises. So we have some questions. We have one from Christina, and she had a question about whether or not, I guess, Revere can be purchased in Canada.
What is Revere?
Again, that's one of the R-E-V-A-R-E-E. I don't know if that was a lubricant or was that, Christina, maybe you can elaborate.
Yeah, sorry, Christina, I don't know that one.
Yeah, it seems
Riverberry.
like it can only be bought in the US right now, so I'm not.
Yeah, I mean, I think, yeah, I think Reap Again works just as well as Riverberry based on, and Reap Again has great results as well. I don't think it's been authorized in Canada, based on the fact I've never heard of it, and I actually haven't heard of it at all. And I speak to a lot of American physios, so I don't know much about it. It may be something they can access through their healthcare provider. But yeah, I find the Reap Again also, yes, does an insertable as well, so it seems to work very well. So there are lots of different ones out there, and again, you know, it's like when we're discussing nutrition and fitness, and you know, it's very hard. You know, we give generic information, but the reality is everybody's different. So I always tell people it's a little bit of trial and error. Unfortunately, it can be expensive, but it's worth it in the long term.
Oh, great. I guess everyone, if you have your questions, please, we have a few minutes here, so please use the opportunity while we have Nicola on the line here to get, you know, whatever questions that you might have answered. No question is a dumb question. So please use the opportunity.
Yep. I'm happy to answer any questions, relevant or not, even if there's something out with what we talked about.
So I had one regarding sex, and you know, there's always these stereotypes that, you know, if you've hit 70 or 80, you know, sex is kind of out of the question. Generally, people aren't going to have, you know, interest anymore at that age. I mean, is that a myth? I mean, should we be, you know, active and, you know, well into those age categories?
Absolutely. I mean, I think it's a big fallacy that when we get old we should stop having sex. I have clients well into their 80s who are very sexually active. In fact, more so probably than people in their 30s. And yes, there are things that can get in the way. So, you know, from a male perspective, you know, erectile dysfunction can be part of it, which can be pelvic floor related, but there are ways around these things. You know, there's medications, there's exercises, and I think we just have to stop putting a limit on what sex is for people. Things need a little bit, people just need to be a bit more open to the fact that, you know, what maybe is good for you isn't good for somebody else. So there, you know, I always tell people there's no normal when it comes to sex. It's completely your own choice.
Oh, great. Christina had another question. So I don't know if there's maybe a reference point, but if you knew of a great pelvic health floor physiotherapist in Halifax, or if there's some place that we can. Oh, okay, great.
I know 2 or 3 in Halifax. It depends whereabouts you're looking for. I actually used to live in Halifax, so yeah, there's
right.
There's a really good website called Pelvic Health Solutions, and they have a great listing for pelvic health physios. The person I'm thinking of is in Bedford, Christina. I just need to remember her name. We did a course together. I know it's an Italian name, but yeah, I'm pretty sure she's at the Bedford.
We can always send it off in a follow-up email. We'll send out that link. And,
yeah, great. Yeah, so yeah, it's very easy to find pelvic health physios. And if any of you are in the States, pelvic, or know anyone in the States who's looking for someone, pelvicguru.com. But I can send that information to Jennifer, and she can forward it on.
Yeah, Nicola, if you can just switch the last slide. So all of our contact information is there. So if you if you have any questions or anything after the fact, after the presentation, feel free to reach us to it there, and then we'll do our best to get them answered.
Yeah. Pelvic Health, Carolyn, it's Pelvic Health Solutions. If you just Google that, or Pelvic Guru.
Carolyn, we'll send out an email after this to all the attendees with that link, with that website, just so you all have it as a reference.
Yeah. I also have a good reference from the Women's Health, the Women's College Hospital in Toronto that I'll send to you, Jennifer. It's just a really nice handout to give to people.
Oh yes, I saw that. That was a really good one, and people can give it to their friends, family, or clients or whatnot if there's any need for that information.
Yeah, I know 3 of the people who wrote it, so. Perfect.
So sorry, just quickly about bowel movements.
Yeah.
So you're saying 1 to 3 is perfect.
Yes.
I did hear some silence when people were saying 3 bowel movements a day.
Yeah.
Seemed to be a shocker. I guess just diet is the big one, or are there other things like, you hear things about intermittent fasting or things like that to potentially help the digestive system?
Yeah, I mean, I always suggest people start with their fiber. People don't really realize how little fiber we actually take in. People are like, oh, I eat a couple of apples a day, and I'm like, well, that's like 8, maybe 10 grams of fiber. I think with the kind of popularity of diets like keto, where people really aren't finding fiber from other sources. Not that I'm going to get into an argument about keto, but I think you have to look at your overall wellness when you're thinking about undertaking a diet program or plan. Again, there's great information out there, but the thing I tell people is, go and get one of those little free apps on your phone, and for a few days punch in what you eat, and then you'll see how much fiber you're actually taking on board, and you'll probably be surprised. Most people severely underestimate. I normally suggest to people, they can use Metamucil, but also magnesium. The supplement magnesium citrate is a really good option to help improve your bowel movement. So if you're not even having one a day, magnesium's a good option. Start with 1 in the evening, and then build up from there. I saw Sandy saying, 27 grams of fiber a day is good. And you should be getting it from soluble and insoluble sources, and that's just an easy Google. I always tell people I'm not going to give you a list of all the different things, but go and have a Google. Google can be useful when we're not trying to diagnose our own health conditions. I always tell people, try and get your fiber from real sources, but if you really struggle to do that, Metamucil is a nice option. Restorelax is not. I'm not a fan of Restorelax. Take a magnesium supplement, which is, most of us are magnesium deficient.
Okay, great. Well, if there's no other questions, I just wanted to thank everyone for taking the time today, as Nicola mentioned, to educate yourself on your pelvic health. And, it's such a this topic is just not talked about for whatever reasons. So really appreciate you guys taking the time today to learn. If you do have any questions, don't hesitate to follow up with us afterwards, and we'll be happy to answer whatever questions that you have. So with that, we will end the presentation. Oh, and please provide us with any feedback that you might have, or if there's any other topics that you would like us to discuss in the future. We are trying to, promote education and awareness about many of these underlooked health issues, and trying to bring that and use this platform as a way to bring that to light. So thank you, everyone. If there's any other questions? Another lymphedema course. So Corey, yes, we will hopefully be planning a couple more lymphedema fitter training courses. We're thinking maybe in March we will have something, but we'll take your name down and then we'll be for sure to send you an invitation when that's all arranged. Neuropathy, that's interesting.
Yep.
Yeah.
Yep.
So thank you, Sandy and Corey, for those suggestions. No, good. All right. Take care, everyone. And thank you again, Nicola. And everyone,
No
have
problem.
a great day. And hopefully there's not too much snow on the floor, ground where you are. So drive safely if you have to commute anywhere.
Yep. Thanks, everybody.
Kara will also add you to the lymphedema list.